Hi, folks. I'm Wound Care Karen. I love being a nurse and I have a passion for wound care. I want to inspire nurses, educate patients, and have a little fun along the way. Listen, I met the coolest chick on Facebook. She's got a podcast called Living My Breast Less Life, where she discusses her struggles and triumphs with breast cancer. So today, through the magic of Zoom, I have the honor of interviewing this survivor who's also a wife, she's a mother of a toddler, and she's a medical social worker. Heather Pennell-Glover, also known as HPG. Welcome, HPG. Thank you so much for Zooming with me today.
Hey, Karen. Thank you so much for having me.
This
So
is
happy to
so
be a
cool.
part of your show.
Thank you. And I really
Yeah.
love Facebook groups and forums. I'm, meeting people all over the world that we would have no other way to meet. So this is
Right.
really cool.
Absolutely. Yeah. Thanks for having me on your show. I've really enjoyed it.
Awesome, awesome. So do you mind if we just dive right in? We'll just start at the beginning. Can you
Let's do
tell
it.
us a little bit about when you were diagnosed? Did you have symptoms or how did you know to get tested?
Well, I had no symptoms. It
Wow.
was 2021. My daughter had just turned 1. I had just turned 41. And
Mm.
I was just kind of checking the wellness boxes.
Mm-hmm.
My daughter and I are a day apart in birthday. So
Aw.
she came home from the hospital on my 40th. So
Mm-hmm.
that was in the very beginning of COVID. So a lot of wellness exams just weren't happening at that time. So in summer of 2021, I had gotten a promotion. She had just turned 1, just making a
Mm-hmm.
lot of good, positive life changes. And I just kind of went down the list of like things that had sort of been neglected. Um,
Right.
for
Because
preventative health.
in 2020, that's pretty much lockdown. Everything was
Yep.
locked down, shut down. All of that was tossed to the wayside while we were all struggling with the world pandemic for sure.
Yeah. And I think I just thought, okay, well, when you're 40, you get a mammogram and
Mm-hmm.
I'm gonna go, see my gynecologist, get a mammogram. And just I literally made a list. I had no symptoms. I did not
Mm-hmm.
feel a lump.
Mm-hmm.
I went to it was my very first mammogram
Mm-hmm.
and it was a Friday afternoon. I was the last patient of the day and I almost canceled
Oh, wow.
because I was busy at work and I needed to pick my daughter up and something just said, just go. And I did. And that was a Friday afternoon and they called me on a Monday.
Mm.
And I've been in the medical field long enough to know that if they call you back that quickly, it
Yes.
could be an indication that they saw something. I
Mm-hmm.
honestly, as strange as this may sound, thought they were calling to collect a copay because I was the last patient of the day. And I thought it was like the billing department to say,
Right.
like, hey, you need to pay us your copay amount. And that was not the case. They mentioned you have a 1 centimeter mass and you need to come in tomorrow for further diagnostic testing.
Wow.
That was at the end of the day on Monday. I remember exactly where I was standing. I was at work.
Mm-hmm.
And yeah, so that's what I mean. It happened very fast.
Mm-hmm.
Friday, Monday. And,
Wow.
well, when they said come back for further testing the next day, I was
Yeah.
like, okay.
Wow.
Yeah, it was a lot to process. I told Martha, my wife, she had actually picked our daughter up, and I was very careful to share that information once she got home.
Not while she
Um,
was driving or
Not while
yeah.
she's driving, no. As a medical social worker, I've delivered a lot of bad news on the phone, and I've always thought, is this person driving? Like, is this a
Right.
safe time to share this? I've always been aware of that. And I told her as soon as, we were in person, and
Mm-hmm.
she's a nurse. So,
Oh.
yeah, so she went with me the next day, and I could watch her watch the screen.
Oh.
Now, to me, it all looked like a weather meter. I couldn't see anything. It all looked gray and splotchy,
Right. Yeah.
like a weather
Cloudy.
report.
Right.
It's my
You didn't know
non-clinical
if there was
explanation of
a
an
front coming
ultrasound.
through or what, huh?
Right. So after it was an ultrasound and we got more diagnostic mammogram, I got a call the next day
Mm-hmm.
while I was at lunch
Mm-hmm.
and at work, and they said it had blood flow. And I knew right then. I was like, oh,
Yeah.
okay. And they said, we'll be calling and schedule a biopsy that they scheduled the next week.
Okay.
So it
Mm-hmm.
happened very fast.
Mm-hmm.
Again, I didn't feel anything. And after I knew it was there, I started feeling around for
Right.
it to see. I couldn't feel anything. So,
Wow. So
yeah.
the next step was a biopsy then?
Yes, I had a
Okay.
needle-guided biopsy at the very end of July. And I remember my surgeon, who would become my surgical oncologist, he just said, I need tissue. And I
Mm-hmm.
remember thinking, what a strange thing to tell a person, from being on the other side of it, just being a patient. I was like, I hear you. You need to run the test. You need tissue.
Right.
It was painful, but I think it was more emotionally painful.
I'll bet. Yeah.
And because I just knew.
Oh,
And after I got the biopsy, they put a clip in and they did a mammogram after that. I remember that being really painful. So,
okay.
yeah.
Wow. And this whole time you're still going to work.
Oh, yeah.
You're
Hmm.
taking care of your daughter. It's
Yeah.
business as usual at the HPG household.
Always,
No,
always. And I went to work. We were getting ready to go to Maine the following week for our very first family vacation.
oh,
And, we had our flight booked and all the details. We were ready to
yeah,
go. And so, we were just trying to cope, one moment at a time, one day at a
yeah.
time. I really tried to avoid the internet. I
Okay.
always
So you didn't go
say that
down the Dr. Google rabbit hole.
no, me and Dr.
Wow.
Google had a divorce. He got everything in that divorce, and I just
And
walked
he can
away.
have it,
He
right?
can have it. Because I thought, oh, I don't want to be on these sites and,
Right.
hear all these horror stories or even success stories. I just thought I need to hear it from the provider
Mhm.
and, what type and what.
Yeah, right. There's so much unknown yet. Yeah, you didn't even know what to ask yet because you didn't know what stage, had it spread, all that.
Mhm.
Yeah. Well, kudos to you for not doing all that deep
It was
dive
it
because
was
that
tempting.
I bet, I bet.
Part of the like positive life changes was like stopping going down
Hmm.
internet rabbit holes. Like
Just in general.
in
Yeah.
general, I
Yeah.
had quit that in April, and it was one of the things I was like, that's not healthy for me. So I,
Awesome.
I stuck true to that, and I got the results back the day before we left for Maine.
Wow.
And it was just a couple days. And what I knew at that moment was it was hormone driven,
Okay.
greater than 90% estrogen, progesterone positive,
Hmm.
and that I needed an MRI for more imaging.
I see.
So that was going to, oh, and genetic testing. They wanted to do genetic testing because of my age.
Okay.
And that takes about 2 weeks to come back. And the MRI was scheduled about 2 weeks out. So we just went to Maine the very next day.
Good. Oh, that's
Yeah,
good. I'm glad to
it
hear
was
that.
important. I didn't know what my future held, but I knew that I wanted to spend that time with Martha and Piper on an
Awesome.
adventure. And I really tried to put it aside
Hmm.
and be present and enjoy the ocean and the food and really live in the moment. I ate a lot of ice cream to cope. Probably not the best, but it's better than some things.
Right. I was going to
And
say, of all vices, I think that's pretty benign.
yeah, I joined my first like breast cancer support group on Facebook on that trip.
Oh,
And
okay.
I tried to be really mindful of like, let's not talk about cancer right now. There's nothing I can do. I
Right.
don't have all the information. Let's
Mhm.
just be present.
Oh, that's awesome. Now, and we mentioned that you're a medical social worker. Did
Mhm.
that help in this process, especially in the beginning here, or was it an hindrance? Because sometimes you can know too much, right?
Yes. So part of the background I'm most proud of that I've enjoyed the most of my career was a hospice. I was a hospice social worker for years
Mm-hmm.
in my 20s. And so I'd seen a lot
Yeah.
of folks at end of life,
Mm-hmm.
specifically breast cancer, all cancer, really all illness.
Yep.
And then I had left and went to the acute care setting in the hospital and worked the oncology floor. So I had seen both professionally.
Wow.
So I
Yes.
knew enough to be like, okay, there's hope,
Mm-hmm.
but you know,
Yeah.
I
Somet-
I, I
Yeah.
think it was helpful in terms of advocacy and like understanding some of the words. And I gave myself a lot of grace because I would used to tell my patients that patients typically only hear 15%
Mm-hmm.
max of what the provider says.
Right.
So I just really tried to give myself some grace and, taking notes and asking, like, hey, can I record this? Because I don't think I'm going to remember
Oh, that's a great
these
idea.
details.
Yeah.
And I think those, being in this business for so long, I think I had some like self-reliance there.
Mm-hmm.
But I did know enough to be dangerous, right? So,
All right. So then that leads us up to, so you get back from Maine,
mhm.
and then you had, so that you did the MRI and you did the genetic testing also?
Yes, and I found out I was negative for all 84 genes tested on my flight back.
Oh, okay.
I flew back on a Sunday. I had my MRI on a Monday. My
Mm-hmm.
daughter started a new academy that we had planned.
Mm-hmm.
So there was a lot of stress, coming back
Mm-hmm.
from a trip, putting your precious baby in the hands of strangers. And
Yes.
this was still in COVID, right? I mean, in my thoughts, we still are. I have COVID now. So
Right.
we just like handed her to masked strangers. We couldn't go in the classroom. So there was a lot of
All
anxiety
right.
there and adjustment
Wow.
there. And then, yeah, so I had the MRI and it showed more cancer in the breast than they had thought.
Mm.
And the left one had to go, and the right one had a lot of questionable areas. And I had a choice of coming back, like having the left one removed and then coming back every 6 months for close monitoring.
Oh, wow.
And I, if anything, at times can be very decisive. And I was like, no, that's a level of anxiety that I just cannot live with. So I decided that I was going to have a double mastectomy very quickly.
Mm-hmm.
I'm very grateful to have the insight and the knowing of like, no, this is the decision that's right for me.
Mm-hmm.
And just feeling very confident in that right away.
Yeah, that's great.
Yeah, just having that knowing. And then there's a lot of hurry up and wait,
Yeah, right.
let's just more wait.
Yeah, what was that time frame like then? So you met with a surgeon, I imagine, and
Mhm.
talked about the plan. What kind of wait was there after that?
Yeah, so I met with the surgical oncologist that did the biopsy.
Mm-hmm.
He wanted me to see a plastic surgeon.
Mm-hmm.
Um, Talking about being in this business for so long, I think that it kind of felt like I need you to see this to make an informed decision. I'm gonna check this box so we could do this consult so we can either do reconstruction or not. Give you all the information. So when I met with the plastic surgeon, it was maybe right before September, beginning of September, we
Mm-hmm.
talked about a couple options. I was a candidate for either just a double mastectomy with like flat closure
Mm-hmm.
or immediate reconstruction with silicone implant. And the reason I was a candidate for that was because I had good skin integrity, something that I never thought about before. Was a
Right.
good candidate for healing and had a smaller chest. So that was in terms of breast size. So that was just easier to take the breast out, put the implant in,
Okay.
sew it up. It was, some people take, and I can't remember the term, but some people take tissue from other parts of their body, but that was not an option for me because there was no surgery availability until the next year
I
for
see.
that surgery, and time was of the essence.
Right. Right.
Mhm. Yeah, some folks who get diagnosed with breast cancer who are like BRCA positive, who may not need, some folks have a little more time.
Mm-hmm.
I did not.
Right. You
So,
had a loaded gun pointing at you for
I
sure.
did. I
Yeah.
most certainly did.
And you went into this already having a type of congenital deformity, right? We talked about that briefly on the phone
Hmm.
before, called
Yeah.
pectus excavatum. I've also heard it called like sunken chest or hollow
Mhm.
chest. And how did that affect your the plan?
Oh my goodness. Well, the first barrier was I was asking, if you're going to operate on a person's chest and
Hmm.
it's sunken in, it's pretty significant.
Hmm.
Like how does that affect surgical outcomes?
Hmm.
If it's shaped different, that would, in my thoughts, guide the course of surgery in a different way.
Right, because it's a
And
bony deformity. It's not like
mhm,
it can be manipulated else, differently. It's a bony deformity. Right.
mhm. And I brought it up to my surgeon, and they were like, "Oh, no, it's not a big deal." And I was like, "Well, I need a little more education. Have you ever done a mastectomy on a person that has a sunken in chest before?" Like, "Oh, we can do, yeah, we could do this." I'm like, "I hear you, but have you done it?"
Mm-hmm.
And I even asked my plastic surgeon, who was like, "Oh yeah, my ribs stick out too." And I was like, "Well, that's nice, but my whole chest is sunken in. It's not just the rib piece that sticks out; it's the sunken in part." So, like when I was born, it was like somebody took a little cereal bowl and made a mold and took it out. So it's a pretty significant deformity, but breasts cover it.
Right. Right.
And Martha, being a nurse and
Mm-hmm.
having those good clinical thinking skills, was like, okay, what about a risk for like infection of the lung? What, like from a cardiac standpoint, because the sternum is more pronounced on like the breast, the sternum is, it beats more on, my heart beats more on the sternum. So she was concerned about all of the whole picture.
Exactly.
And I called and asked to speak to the nurse, and they're like, "Oh no, we've seen her without her shirt on. It's fine." And I could hear them talking back and forth about
Mm-hmm.
me, and I was on the phone.
Oh, that's
But
interesting.
I felt very dismissed and almost like, this is a very popular word these days, but I felt gaslit about it.
Mm-hmm.
And I almost questioned, like, is it as severe as I thought it was? I'm pretty sure it is. I mean, it was a big point of like cosmetic for
Mm-hmm.
me. Like it was a big focus, like getting a bathing suit and like trying to camouflage it.
Right. And especially
And
because you had dealt with it all your life. You
mhm,
you you could see it as a child. So this is something you knew all your life, a deformity
yes,
you had.
yes, that hits, from a practical standpoint of like having bras, trying to find bras that fit, or like,
Mm-hmm. Mm-hmm.
I mean, it was an everyday part of my life
Mm-hmm.
to the point like Martha wanted to get a baby picture of me from my mother and be like, "Look, here, can you see this?" And I am a little feisty and asked my surgeon, it's like, "Listen, if you'd worked on Fords and Chevrolets your whole life, would you just go in on like a foreign car, a Toyota, without thinking about it?" And they just looked at me like, like, what kind of question is that? I thought it was a pretty valid question. It's the only analogy I could think of.
Right, right.
But that was hard because I wanted to be heard.
Mm,
It is my body
mm,
that I'm giving you consent to operate on because I want to stay alive.
mm-hmm,
And I want to make sure that you understand, or more importantly, that I feel comfortable and confident when I undergo my very first major surgery.
mm-hmm,
Because, I've heard patients say, like, we are the expert in our own experience. And that is 100% accurate.
mm-hmm,
And I think that folks, if someone would just say, "Yeah, I hear you.
mm-hmm,
I hear that you're really concerned. I'll consult with a colleague,"
mm-hmm.
or "I am confident that X, Y, and Z will be as okay as I can guarantee."
Right.
Just some
Or
reassurance or just
right.
active listening or some type of communication other than, "Oh, no, it's fine. Oh."
Yeah, just the poo poo. No, no, never mind, honey. You'll be all right.
Yeah. So as it turns out, the surgery was longer than they had anticipated. The reconstruction was more extensive
Mm-hmm.
on the right than the left, and I lost a lot of blood, and I had to be on oxygen. And the next day when they came to see me, they were like, "You gave us a run for our money." And I'm thinking, that's okay. So let's. And what I heard was, "I tried to tell you that you're going to be the hero."
Right.
Yeah,
Yeah.
because we got to manage their egos, right?
Right.
When it's our body, I try to tell you, but I didn't say I told you so, 'cause that sounds like a snarky thing to say, but
You're a stronger woman than I.
I think it was the meds. But
That's
yeah,
one of my biggest pet peeves, though. And as a nurse, I always advocate for the patient because I have been in situations where the patient themselves is trying to tell the physician or provider something, very much like you did about your chest wall cavity. And I can tell the provider either isn't hearing it or
mhm,
doesn't want to hear it. Again, they're just poo-pooing them. No, 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 you'll be all right. I will do it. This will do it. And
uh-huh.
I always take it upon myself, to stop the conversation, but doc, they have questions about A, B, and C,
Mhm,
just to try and bring forth that dialogue,
mhm,
to re-examine, because clearly you had a concern about something
mhm,
very valid.
mhm.
Wow. And it just wasn't heard.
Yeah, and I
So,
think from a professional standpoint on my end, I've translated physician speak to
yes,
patients my
yes.
whole career. And I would hear something and I would just watch the patient and think, I don't know that she understood.
Hmm.
And then I used to wrap it up and say, like, do you have any questions? Is there something you need clarity
Yes.
on? Or I noticed that you took a note here.
Hmm.
Do you have any concerns? And then I would talk with the patient after and try to explain it in layman's terms
Right.
and help them process what they heard and, explore emotions around that. So
Hmm.
to not have that
Mm.
advocacy, because it takes a lot of energy to advocate for yourself if you're an advocate for others. Because I don't know how, it's like I had to learn how in a way.
Right. So tell us about recovery. So you ended up having several hours tacked onto your surgery, I'm sure.
Hmm.
And like you said, that leads to extra blood loss, extra complications. So tell us a little bit about your recovery then. Did you leave with drains? Did you have any other type of devices? What was that like?
Yeah. So in the hospital or after the surgery, I woke up with four drains and and you'll know this, you're the expert, but they were like sutured to my side, like by my ribs,
Right.
two on each side.
Hmm.
And they were hanging down and they had like a pump on the end. Or that's what it looked like to me.
Hmm.
And they did a lot of teaching about like you drain the blood out and they gave me little measuring cups and they taught me how to do it. I was
Hmm.
very scared to do it. I didn't want to touch it. I
Oh,
didn't want to pull it out. I didn't realize that
yeah.
it wrapped all the way around like my breast. I didn't know where it was.
Yeah.
In forms of drains, or I was brand new to that. So came home with four drains and I was in the most uncomfortable bra thing I have ever been in my life. I felt like I had like barbed wire around my ribs.
Oh.
It was so tight, and I understood that was for compression
Hmm.
to keep swelling down,
Exactly. Yes.
but because of the chest wall deformity, they had to, like, put this big bandage on the left to keep the implants separate so they
Separate.
wouldn't
Oh,
become one,
a mono boob. You don't want a mono
right?
boob.
And I was like,
Wow.
"What in the world is this giant thing?" I didn't realize it was like a placeholder, like a literal space holder. I
Wow.
thought it was part of the dressing.
Right.
But again, I had been in surgery forever. I'm like, that's a myth.
Right.
So I had this big gauze taped around my left breast and tons of incisions from the bottom of the implant, like to where your nipple would be. But
Okay.
I wasn't able to uncover those for quite a while.
Right.
And I was terrified of them.
Hmm.
I could feel a lot of pain, but I couldn't describe it because
Hmm.
a lot of the nerves were damaged. So I was in a lot of pain, but it was a different pain than I'd ever experienced before.
I bet.
So
Eh,
I had the drains and like you had to measure the output, I think every 3 hours and keep a log,
right.
which I'm pretty detail oriented. So I had my log and my wife really helped here because I don't remember the first couple of days being home.
Mm.
But my plastic surgeon said that I could not take a shower for 2 weeks. She did not want any of this getting wet.
Okay.
And she didn't want me to shower with the drains. And another dignity thing from a social work perspective is they mark on you with purple marker. So
Yes.
not only am I just in this corset type compression bra that felt like barbed wire, I have purple marker written all over me that I really wanted to get off,
Hmm.
but I couldn't. So it's just a really interesting, which things I've never thought about before.
You never had to. Right. And what kind of, besides the not showering for 2 weeks, what other kind of restrictions were you restricted regarding lifting or reaching or twisting?
Yeah, before the surgery, I had to prepare. So if you do like T-Rex arms, you can basically reach out just as far as like a little T-Rex dinosaur.
Okay.
So if your hands are in front of your breasts, that's about it.
Mm.
In terms of range of motion, nothing high, nothing low,
Right. Gotcha.
nothing too much to the left or to the right.
Hmm.
Not any bending over. My heart rate had to stay under 100.
Okay.
I could not lift anything over like a half gallon of milk
Mm-hmm.
for, I believe it was 6 to 8 weeks.
I bet. Yeah.
So I had put everything that I thought I might need within those little T-Rex arm lengths. And
Okay.
since we're on a nursing podcast, I thought, how do you wipe your bottom in that instance? We figured all that out. But so that it was very like very limiting physically.
Mm-hmm.
And
Mm-hmm.
then I had a mastectomy pillow. When you drive in a car or ride in a car, because you got your seatbelt on, you definitely don't want that seatbelt rubbing against
Oh, that's a
that. And
great idea.
if
Okay.
you were if you were to get in a bump up or what have you, you want that barrier.
Yeah.
And after you have a mastectomy, and I unfortunately had it spread to my lymph nodes, you get real popular with all these new doctors and all these appointments and all these follow-ups. And you're in the car a lot. And
Mm-hmm.
some of my rehab for for my physical therapy was like, I'm gonna make it halfway through Target after this doctor's visit. That would be my goal.
Uh-huh.
And I would just kind of lean on the buggy. That was my like adventure treat
Yes.
if I had the energy after my doctor's appointment. So
That's awesome. Yeah, I use target therapy as my
yeah.
recovery many a time also. So I imagine your wife was a big help then during recovery,
Mhm.
especially being a nurse. I mean, that's really, really awesome. She was able
Yeah,
to be there.
she was able to help with to look because I was anxious about the incisions because I couldn't see them because they were
Right.
the under part. So I
Mm-hmm.
could see them in a mirror, but I couldn't see them to look for signs of like infection or
Right.
if it's healing properly.
Mm-hmm.
I don't know what it looks to heal properly. So
Mm-hmm.
she was able to keep a watchful eye for that, like taking temps to make sure like you weren't spiking a fever for infection and really monitoring all that. And then the diet piece that was important was to make sure that I had adequate protein for healing.
Yes. Yes. Very important.
And I am goal oriented. And when she said when my plastic surgeon said I had good skin, I was like, okay, I'm gonna keep it that way and I'm gonna heal properly. So I
Mm-hmm.
tried to do like the protein shakes and
Mm-hmm.
I did not have much of an appetite, probably because of the medication
Right.
and the pain. And I would just try to get as much protein as I could. But after you have a big surgery like that, like your bowels are waking up and
Mm-hmm.
I was on narcotics for just a very short period of time, just a couple days, but like constipation. So like
Mm-hmm.
you're kind of chasing like how do I do input output, so to speak, and you still get the nutrition, but be able to do these bodily functions and stay within these physical limitation parameters and stay sane.
Right. Right. No small
Oh,
feat,
there's
I'm
that part
sure.
too. No, mm-mm.
And did you have any problems with your incisions or drains? Did any of them happen? Did any of the incisions happen to open a little bit, or were you able to get your drains out in a fairly decent amount of time that you consider?
One did really well, and I got
Hmm.
it out in a week.
Oh, awesome. Superstar.
And I was so excited. And I got the second phase of them out the next week. So it took 2 weeks to get the drains. Luckily, the incisions healed up nicely. I still had little scars,
Mm-hmm. Mm-hmm.
but they healed up pretty well.
Awesome.
Yeah,
That's
luckily
great.
I didn't have a lot of like, my plastic surgeon was just like, leave it alone.
Yes.
Don't touch it. Don't let anybody touch it but me.
Yeah, I say set it and forget it. If
Yes.
for folks that are Gen X like us that remember Ron Popeil and the rotisserie chicken, set it and forget it. Yeah, that's because that's what wounds and incisions like. They want to be warm. They want to be left alone because every
Hmm.
time you take a dressing off to look at it, it chills. It becomes the room temperature air hits it and it chills and it's like a shock to the incision or the wound. So yeah, I try and tell all my patients like leave your bandages alone, change them as infrequently as you have to. Yeah, that's
Yes,
great. And did you need chemotherapy?
I did.
Okay.
Yes.
And
So
was
when
that
I
was that after surgery then or during
Yes,
or okay.
it was after surgery. I found out that the cancer had spread to the lymph nodes,
Hmm.
and I was going to require 5 months of chemotherapy and radiation. I was very depressed. I have to
Mm,
say.
mm,
That's a hard thing to hear. I had an aggressive cancer and they wanted to treat it very aggressively, which
yes.
I was thankful for. It's a perspective shift, you know. It's
Right.
like, okay, this is going to be hard, but this is going to save my life. And once you have lymph node involvement or any type of cancer spread, you go through the body scans.
Mm-hmm.
And of note, they are not easy physically to do after you've had a mastectomy with immediate reconstruction, going through those tiny tubes,
Oh, wow.
and just getting on and off the table, just things you don't think about. And the scans came back that had a large pelvic mass. And to make a long story short, I went for chemo teaching. I felt like this was backwards, but I went for chemo teaching that morning and met my medical oncologist and then saw a surgical oncologist who did the ultrasound. And I was laying on the table looking at the ceiling and he said, "We're doing a total hysterectomy."
Wow.
Yep, I was looking at the ceiling and my feet were in stirrups.
Mm,
And there's so much that goes through your mind. Like, is it like metastasized?
mm-hmm.
Is it a secondary cancer? Like,
Right.
what is this? And I asked, like, is it attached to the left ovary or right ovary? Like, give me a geographical region here. And he couldn't answer. He said, "I don't know. It's very big. I can't tell." And I was like, okay. And we had talked about the possibility of a hysterectomy in the future because my cancer was hormone driven.
Right.
So we went to the scheduling office and it was scheduled for the total hysterectomy was scheduled for November 18th, which was oddly enough the day I was supposed to start chemo.
Oh, wow.
So that was a very quick adjustment and change of plan,
Mm-hmm.
we were coming on the holidays. Like
Oh,
I had just had a major surgery, October 1st, and, a month and a half later, going in for a second
yeah.
major,
Right.
a lot of unknowns, a lot of waiting.
Mm-hmm.
And it felt really spontaneous in the surgery scheduling world. It was fast, like two
Okay.
weeks
Wow.
scheduled. And he was saying, like, we may have to cut your abdomen to get this out. We
Mm-hmm.
may can take this out vaginally,
Mm-hmm.
but we don't want to spill it
Mm-hmm.
because if it's cancer, there you
Right.
go. And I appreciated his transparency, but I was scared.
Right.
And he did the surgery, part of the surgery with a robot, and I had never heard of that before.
Uh-huh.
And I was just like, a robot? Like, this is so bizarre. So perspective shift was like, okay, let's hope that it's laparoscopic and vaginally, and that he
Mm-hmm.
doesn't drop it. Talk about trust. And what I think is so important to build a rapport, if you can, with your medical team,
Mm-hmm.
because to trust your body, like, don't drop it,
Mm-hmm.
like, let's get this out of here, see what it is. Had the surgery, it was laparoscopic, luckily. It was not cancer, but they did drop it.
Oh.
It was it was a huge endometrial cyst. And
Oh.
when you drop those, it causes a lot of pain.
Mm.
And I had suffered from endometriosis my whole life.
Oh, I see.
So that was a plot twist that I did not see coming at all. And like what I learned of being a cancer patient was like, hey, not cancer. And we were starting chemo December 14th.
Mm-hmm.
I was like, wait, I just had a total hysterectomy. Like, I
Mm-hmm.
can't have kids. Like, I'm in menopause at 41.
Right.
Whoa. But nobody wanted to talk about that. One of the reasons I started my podcast was to talk about the things that people don't want to talk about and
Mm-hmm.
bring education and light to topics that are real that people suffer. Like, yes, I was a cancer patient. However, that was a big loss.
Yes. Huge.
Losing any possibility of ever having another child
Mm-hmm.
and losing that part of me was harder than my breast
Wow. Yeah.
on me emotionally. And like from a scarring perspective, I can see those scars
Yes.
more on
Yes.
my stomach than I can from the mastectomy, just by the way, our bodies are
Mm-hmm.
made. And breast cancer patients gain a lot of weight. I
Mm-hmm.
did not know that. So I'd gained some weight and I had this bloat up belly. And it just didn't do a whole lot for your self confidence, or mobility. But those incisions held up well. Again, I was focused on my protein and trying to stay ahead of knowing I'm about to start chemo. I
Mm-hmm.
wanted to try to be as healthy as I could be.
Right, because chemotherapy itself would impair your healing. So, yeah, you were in a race against time to try and quickly heal up your incisions because you were going to start chemo very
Yeah.
quickly, I imagine. Wow.
Yeah. And I had pre surgeries, like
Mm-hmm.
post mastectomy pre-hysterectomy, I started going back to work, and then we shifted to the hysterectomy. I was out of work for 2 weeks, back to work, started chemo December 14th, and graduated April 27th.
Oh, wow.
So it was a long journey.
Mm-hmm.
I had no idea what people really go through. I had no clue.
Well, but you went through so much. Like it
Right.
was more than just the breast cancer. It was more than just the spread to the lymph nodes. It was then this whole hysterectomy and delaying your chemo because of it. And yeah, I mean, it's wow. You had the full meal deal for
I
sure.
did. I
Yeah.
most certainly did. And I'm a very tenacious person, thankfully. And I had a will to live. I have a little girl,
Mm-hmm.
and I'm young. In the cancer world, I'm very young. So,
Yes. And I'm sure that's why they were so aggressive too,
mhm,
as far as the time frame and all that. And
yeah.
to their minor defense, I can say that, I'm sure that's why, especially during the hysterectomy and everything, why they were just in a hurry to save your life. That's perhaps why they weren't hearing so much about the rest of you,
Mhm,
but wait, so I'm going to menopause and I can't have children. Very often we providers, we lose ourselves in the diagnosis. We lose
mhm,
ourselves in the disease or the process and just thinking, my gosh, we need to save this person's life. And we stop thinking about the person as a whole at that
uh-huh,
time. And we forget all about your emotional health, your spiritual health, your sexual health,
mhm,
all of that was sometimes that gets lost by the wayside. So I
yeah,
think that's part of your inspiration then too for moving forward. So I
yeah.
absolutely love the name of your podcast, Living My Breastless Life. I love
Mhm.
that.
Thank you.
So you decided you came through this horrible struggle.
Mhm.
And at what point were you listening to other podcasts, or what made you decide, I think I'll do a podcast about this?
Yeah, so December of 2021, I started thinking about just my life. I did a lot of life reflection. When you get a cancer
Oh,
diagnosis, if you don't reflect on your life, you're not telling the truth.
right.
You're not saying it out loud. You're just keeping it to yourself. I did a lot of reflection, and I've had a really interesting life.
Hmm.
I love podcasts. They kind of ground me. When you're on chemo, you do have chemo brain, and your brain is different. You can't concentrate.
Mm.
Reading books, like I love to read, so I
Hmm.
had to start leaning on audiobooks and podcasts. And I would look for stories similar to mine, and I
Yes.
couldn't find it. And I wanted to connect with someone who understood what I was going through.
Hmm.
And I couldn't quite, I found it, and I found it in many ways, but I couldn't find a story like in the podcast world where I was like, oh, I can relate. I mean, I could relate to some of it.
Hmm.
And then
Pieces
some
here,
of it was
pieces
just
there.
really depressing. And I acknowledge how triggering cancer can be for others to hear about, because it affects people it affects most people in one way or the other,
Hmm.
unfortunately. And I just thought, I love to talk about things that people don't like to talk about.
Hmm.
And I think that sometimes people think that you beat cancer, you check a couple boxes and you're fine. You're not. You're not normal, and you'll never be the same again.
Hmm.
And I want to talk about the things that people don't talk about. And I think the reason that people don't talk about it is because they think about themselves, or they put their self in your story and think like, oh, that's heavy. I want to avoid that.
Hmm.
Or people don't know what to say.
Right.
They really don't
Uncomfortable.
know what to say. So if I could give one tip, if you don't know what to say, don't say anything.
Hmm.
Just listen. I learned that when I started at hospice when I was like 25, 26. And that was the key piece of my success with patients, was if I did not know what to say, don't say anything, because your folks are real fragile at that point and
Yeah.
very vulnerable. And so that's part of the reason. And I was looking for a good hobby that I enjoyed,
Hmm.
um, that was uniquely mine, being a mom, a wife, a social worker. Like, I tend to put myself last. And I was like, I'm gonna do
Hmm.
something for me. I'm gonna do something fun, something creative
Yeah.
that I enjoy. So that's how Living My Breastless Life came about. And I named it that because, living your best life, or living your breast life. And I was like,
Right.
well, those are gone. So living your breastless life. So
I love it.
I had thought about it for like almost a year, and I was like, start before you're ready. Just do it.
Hmm.
Just do it. If
Just
people
bite the
like it,
bullet.
to listen. Don't worry about what people think.
Hmm.
And I think cancer really taught me to really not, the weight of other people's opinions are really not that valuable. Do what makes you happy. And I'm not going to say like you only live once, because I think you die once.
Hmm.
I think you get to live every day.
Oh, that's
So I just, something I wanted to do. And I was like, why not? Why not? What if I fail? What if I succeed? What if I
right.
don't do it? I'll never know. So
Right.
That's what started. And I was raised like in a culture where you don't talk about anything.
Mm-hmm.
You just keep everything looks very pretty, very tight-lipped about everything.
Mm-hmm.
And I want to help people, bring authenticity and realness to a variety of topics, not just breast cancer,
Mm-hmm.
but the struggles that people go through in life. I've heard a ton of them and I've been through a ton of them. So I'm here for it. So,
Right. And you're
yeah,
also on other social media. You have Facebook and Instagram. How can
yes.
people find you?
They can find the podcast is on all major platforms. It's called Living My Breastless Life. And on Instagram, folks can find the links to it as according to HPG is
Mhm.
my Instagram handle. And I am on Facebook. It's my name, Heather Pennell-Glover, and it is hyphenated, but it's long. And I just go by HPG. It's just what most people who know me call me. So
There you go. Well, your story is just, it's amazing. It's so inspirational. And I
thank
thank you
you.
so much for having the courage to share some intimate details with us. I really, really appreciate it because I know, I believe just like you do that there are people out there that need to hear this. They need
Hmm.
to hear, what you went through because they're going through the exact same thing or something very similar. So I
Yeah.
really, really appreciate it.
Yeah, the latest episode came out today on the 17th, January 17th. There's a lot of resources linked in the show notes.
Good.
So I want people
Yes.
to be able to go back and say, okay, I heard her say this. Maybe this resource could help or help a loved one. I'm just trying to help folks in a little different way than I have in my career. So,
Right. Because this episode, you talk about getting your PIC line
hmm
inserted or your, I'm
yeah.
sorry, your Matterport inserted.
Hmm.
Right. Okay.
Yeah,
Awesome.
my port, that was an interesting experience. But it was helpful in the long run. But yeah, it's a hard battle. I do not think I never realized how hard it was.
Mm-hmm.
And I've been in the medical field. I was 20.
Mm-hmm.
I just did not realize. But I think it speaks to like what you were saying earlier, like when you're a provider, you're trying to save their life or put out a fire. As
Mm-hmm.
a social worker, you don't see the whole journey. You just see parts of it.
Right. Right.
So, but thank you for having me, and I
Oh,
really, really
really, really
appreciate it.
appreciate it.
Yeah,
Thank you. So, but
you're
before
welcome.
we go,
Yeah,
as you know, like I'm a big movie fan. I love Hollywood and movies and all that. So I asked this of all my guests. So if there was a movie made about you, who would you want to play you?
I have thought about this, and I'm gonna have a weird answer.
That's all right.
I'm gonna say Angelina Jolie, but not because of her like having the prophylactic surgeries because of her BRCA positive
Mm-hmm.
results, because her mama had breast cancer. Has
Right.
nothing to do with that. But I think specifically like the Angelina Jolie character when she played her role in Girl Interrupted. I think
Okay.
I think that particular Angelina Jolie would I mean she's a sociopath in the in the movie. I do not think that I am that, but I just think her character would probably represent could play me pretty well.
Awesome.
Yeah. Some
Awesome.
of the more interesting details of my life. So
Yeah, and I
yeah.
could see that. And honestly, just her as an actress, she really can do a full range of emotion,
Mhm.
dig deep when she needs to, and then she also brings it to humor and comedy. So, and I love her humanitarian efforts too off the
Yeah.
screen. So that's
Yeah.
a great pick. I agree with you on that. That's awesome.
Yeah.
So thank you so much. I really, really appreciate it. If you don't mind ending with, I love your ending line, your tagline.
Go get your mammograms.
Go
Go
get
get
your
your mammograms.
mammograms.
Yep. Go get your
Oh,
mammograms, y'all.
awesome. Thank you so
Thank you.
much. Folks, this podcast was recorded in January of 2023. It was developed and produced by HPG and Wound Care Karen, and it was edited by Wound Care Karen, and I did it all while watching the NFL playoffs. The views expressed here belong to me and my guest, and not our employers or affiliates. If you like what you heard, please subscribe and give me a 5-star review. And don't forget, check out HPG's podcast, Living My Breastless Life. If you have ideas for future topics, please drop me a line at contact@woundcarekaren.com or message me on Facebook, Instagram, or YouTube. I'm Wound Care Karen, and please remember, folks, time does not heal all wounds. So if that happens to you, seek help from a wound care professional. And ladies, get your mammograms.